This is a headline I read in the New York Times this morning. The U.S. may be losing the fight against monkeypox, scientists say. That could be scary to people.
It's important to know what losing the fight against monkeypox means, because monkeypox is not a pandemic potential pathogen. It's not something that spreads very easily from person to person, but clearly there have been missteps from the federal and state governments in getting their arms around what is a containable virus. We've had faltering in terms of getting the vaccine to people and to messaging to people. And clearly when it came to testing, it's really been behind the eight ball. So we are playing catch up. This is going to go longer because of these missteps, which I think are baffling in the wake of COVID-19, that they continue to still make these types of mistakes. But I do think this is containable and doesn't present a pandemic threat or a threat to the general public. But we need to get vaccine into people. We need to get testing stood up in many of the places where people need to be tested because of their exposures. But really, this is spreading in a social sexual network, and we just have to use the tools that we know to put an end to it.
Well, one of those places appears to be D.C., because in looking at the numbers this morning, most places there's like a handful of cases here or there, a few double digits. Maryland has 15 cases, Virginia 18, but D.C. alone has 64 cases.
Yeah, DC is definitely disproportionately impacted, and that may have to do with the happenstance of the sexual and social networks that this is spreading. And we know that this has gotten into the population of men who have sex with men. It has used certain events, parties, raves to really disseminate from there. And DC is hit harder than most of the other places. And that's why DC needs to be prioritized when it comes to vaccines, antivirals, testing, because this is sort of one of the epicenters of where monkeypox is spreading in the United States. But the thing is, this is something we know how to control.
Right. I do want to get this across, because this was a question that came into the newsroom so that people really understand, because we kind of, dance around like, how intimate do you really have to be in order to transmit monkeypox? Someone asked, look, if someone has an open lesion on their face and I give them a hug and rub up against them, and maybe I even cut myself shaving or whatever, could I get monkeypox that way?
You could get it that way. So skin to skin contact could spread it, especially if there's an active lesion on the other person. But this isn't something you get casually walking by somebody. This is something that's not contagious during its incubation period. So it's not like a respiratory virus. It's very limited in its ability to spread compared to COVID-19, for example.
Well, all of it to say it's important to make sure you understand what the headline is saying and really understand what the numbers are saying. Thank you for helping us sort it all out, as you always do, Dr. Adalja. Really appreciate it.
Thank you.
All right, Marissa, over to you.